Hello, welcome to the Live Fully, Not Falsely podcast. My name is Paul Bueza. In this podcast, we'd like to focus on discussions that revolve around the current nationwide opioid crisis and its effect on our local communities. We hope to empower people with facts, numbers, and resources available to help fight this opioid crisis and bring the nation closer to managing opioid addiction. Today, I wanted to talk about how this opioid crisis came to be. I also wanted to talk about some research from the Centers for Disease Control and Prevention, or the CDC, on what kind of numbers and how terrible this opioid crisis has become. But before that, I always want to remind people who are dealing with opioid use disorder, sometimes we call that OUD, or even know someone wrestling with opioid use disorder, that there are places that can help. The Substance Abuse and Mental Health Services Administration has a national helpline that can work with people who need help with OUD, and they can be reached by calling 1-800-662-HELP or 1-800-662-4357. You could also go online to www.samhsa.gov. If you live here in Illinois, there's also an Illinois helpline, and they are also available to help, and they can be reached at 833-234-6343. You can also text HELP, HELP, to 833-234. If you'd like another way, you can also go online to www.helplineil.org. These organizations are always available to help. Okay, so let's get back to how the opioid crisis came to be and also how bad it had become. So, as a healthcare provider, managing a patient's pain is always in the back of your mind. It's our job. It's what we do. We like to limit suffering. We try to do the things that we can, the best that we can, in order to get the best medical outcome for a person, right? So in 1996, the idea of treating pain became a larger priority, and it had a lingering impact on medicine, right? So the opioid crisis actually started in the mid-90s. So what happened in 1996? Well, this was the year that Dr. James Campbell, who was president of the American Pain Society at the time, gave a speech that coined the phrase, quote, pain as the fifth vital sign, end quote. So we have to identify what vital signs are. Now, vital signs are a series of objective, measurable medical facts that allowed healthcare providers to evaluate the initial severity of a patient's disease. So these were things that we can measure. So we could measure blood pressure, heart rate, respiratory rate, and temperature. That way we could tell if your blood pressure was really low, that you were in a bigger emergency. If your body temperature was really high, that you may have had an infection or something like that, something that would cause you to have a fever, right? These were all things that we look at and could identify and obtain. But pain was a little bit different. Pain was a subjective measure. So that meant that the level of pain is measured by a person's experience. So if we were to put pain on a scale of 1 to 10, 10 being the worst pain ever, my 5 out of 10 pain would be much different than somebody else's 5 out of 10 pain. And if I said that I had 5 out of 10 pain, then because it was subjective, there was no way for any health provider to say otherwise. So this was a novel idea. This was adding a vital sign to something that wasn't something that could be measured. But what happened was it kind of took into account the whole person. So just because we couldn't measure it doesn't mean that pain wasn't there. And so this idea of measuring pain according to the individual who we were treating, well, that kind of led to the idea that we were possibly helping to treat the whole person by allowing them to also give us more information about how they were feeling. So, this idea, well, it took off and it was adopted by the Veterans Association within about 2 years. The Joint Commission Accreditation of Healthcare Organizations, or they're affectionately known as JCO, they incorporate pain management as healthcare standard among healthcare organizations in the U.S. So, again, like I said, this was a great idea because this was the beginning of what we called shared decision making, where somebody can actually give us information about stuff, and it wasn't something that I could measure. So it required us to talk to people to go ahead and get an idea of the care. However, there was kind of a negative side effect to this whole process. One, not everybody was always truthful, and two, well, it didn't always work out the way we wanted it to. So here's an example of that. So since pain management policies had become standard, hospitals and healthcare providers, their performance was rated on patient surveys. So healthcare systems and providers, well, they were kind of incentivized. In order to get a good survey, they really needed to treat pain well. And so that was an incentive for people to go ahead and be a little bit more aggressive about managing someone's pain. And now you're starting to use medications like opioids, who are definitely going to go ahead and control pain, but can become addictive. Well, they were used. They were overprescribed. And so what happened was people became addicted to it. So it wasn't just that people were overprescribing, it was that this was a standard. We needed to treat people's pain. So healthcare institutions could also find themselves in trouble for not managing a patient's pain enough. So this was a circular scenario, and it opened the door to an opioid crisis. So according to the CDC, their research indicates that the opioid crisis occurred in 3 different waves between the years of 1999 and 2022. The first wave occurred between 1999 and 2009. And this is where overdose from opioids that caused people to die involved opioids from overprescription. So this medication was prescribed too often and people were becoming addicted, and then they would take too much and they would die. But between those years, eventually people had come to the conclusion that that was an issue. And so healthcare providers had started to try to wean people off. And sometimes they got cut off of those opioids and they had already become addicted. So that kind of fueled the second wave between 2010 and 2012. These overdose deaths rapidly increased as a result of the street drug heroin. So this street drug became more prominent because people had become addicted to opioids. And so heroin being an opioid itself, it was what they could get. And so this was causing significant overdoses. But again, between the fact that they had over-prescription medications, addicted people, and also available illegal drugs or illicit drugs, that caused an even bigger problem. So between the years of 2013 and 2022, there was a new synthetic drug called fentanyl, and that kind of showed up on the scene. So what do I mean by synthetic opioid? Well, morphine and some of these other medications that are considered opioids come from the poppy plant, right? Fentanyl is a synthetic opioid, meaning it has no poppy plant in it and is completely synthesized in a laboratory. It is dramatically stronger than traditional or natural opioids, almost 50 times stronger than morphine. Right? And it has its uses. We use it for things like traumatic injuries or end stage cancer pain or sometimes surgeries if we need to manage the pain. But when used in the wrong hands or synthesized in laboratories that are not sanctioned, it can cause real problems because these synthetic drugs often come in powder form or liquid form, and they can be pressed into counterfeit medications or used to lace other street drugs. So the CDC identified that in 2022, about 43% of any opioid death involved opioids and stimulants. So there was a mix of medications that created a problem. So as you can see, this problem is going to continue to linger. There is a lot more information that we need to really discuss. And that's just kind of an overview about the level of, of issues involved with the opioid crisis. And so I know that this didn't necessarily answer as many questions as you thought. In fact, I think that it created more questions. But I'm just going to have you join me for the next podcast where we start talking a little bit more about all of these little issues that came to be one of the biggest problems in the U.S. It's a true public health emergency. So thanks for stopping by and listening to me talk about opioids on the Live Fully Not Falsely podcast. We just want to go ahead and make sure that people learn to take control of opioid addiction by learning the facts. And it's a doozy. So again, thanks for coming by.